Hello, wonderful people. Welcome to my channel. And today we will be discussing the three most repeated questions from my viewers. The number one is, how many times should I go for prostate screening? Talking about number of times, it will base on your first visit for the screening. Let's say when you went for the first screening and it came out that you have enlarged or enlarging prostate. That means the doctors will take it from there. They will pass you through the necessary investigations and put you through some management. So they will be communicating to you of the next actions to be done. And in case you took the screening and it happens that yours is normal, your prostate is normal, you don't have to relax. What you have to do is every 2 years you go for another screening, because aging is dynamic, it's not static, and for that matter anything can happen as you are growing. There can be some changes, so to be at the safest side, I would advise you to go for another screening every 2 years. And the second question is there any special food that I can take to reduce my already enlarged prostate, or food which I shouldn't be eating to prevent my risk of already enlarged prostate? Talking about food, we have some fruits containing lycopene. Example like watermelon, red orange, grapefruit, citrus fruits, papaya, apricots, tomato. All these stated fruits is very powerful when it comes to antioxidants, so it can protect the already enlarged prostate or prevent it exacerbating to cancer. So you can eat them. And you can also eat fish containing omega-3 oil, like omega-3 fatty oil like salmon. In case you are a fan of nuts also, you can take in nuts containing zinc. Example like cashew nuts, almond, peanuts, brazil nuts. Mention them, all the nuts that contains zinc, because it contains selenium, which also help to prevent your already enlarged prostate exacerbating to cancer. So it's good. And you can also take supplements, vitamin D. In addition, you can take plant phytosterol from avocado, canola oil, dark chocolates, allium vegetables like garlic, onions. They are all good. They can protect already enlarged prostate and prevent it from exacerbating to cancer. And talking about food which you should also abstain or you shouldn't be taking to increase your risk of already enlarged prostate, if you are a fan of beer, if you take in much beer, like high consumption of beer can increase your prolactin level, which will call for imbalanced hormones, and hormonal imbalance will call for a lot of medical cases, and prostate enlargement or cancer can also be one. So you have to limit intake of beer, should be limited. Even if you can abstain, that would be super, but if not, then limit its consumption. Glycemic food should be limited. Starchy food that contains sugar like white bread, rice, pasta, yam, cassava, they should all be limited. Fatty food, fatty diets, you have to limit them. Protein food, you should limit it, especially animal food, red meat, you have to limit them. Dairy products should be limited. Sodium intake should be limited. Salt content, you have to limit it, because most of the lower urinary infections or diseases will have great symptoms if you take in. If you are taking much salt, you experience most of the symptoms, like you feel it. So you have to cut short of all to prevent it getting to cancer because it's already enlarged. Or even if it's not already enlarged, that one you can practice it now to prevent, because prevention is better. Decrease caffeinated beverages, and that one also will help you. Let's talk about the third question. It says, Doctor, I have been experiencing all the changes you mentioned from the other video. Can I start treating myself as one? No, you can't start treating yourself as one. Go to the hospital. Let doctors confirm before, because all the mentioned symptoms or the changes, they can be seen. They are commonly seen in most of the lower urinary tract infections. That's why you need a doctor to confirm, because we can rule the odd out and come with the main diagnosis, because we are professionals, we have our own strategies we pass through. And even when we diagnose you as you having already enlarged prostate or hyperplasia of your prostate, we don't just end at your prostate being enlarged. We make vivid investigations. Even when we notice that, we can pass you through some investigations to the extent that we can take some sample of your tissue, study and see if it's cancerous or not. And even if it's cancerous, what stage has it gone to prevent it spreading to the other organs, to adopt a perfect management or treatment for it. So please don't start treating it as one. Go for mean or well diagnosed, I beg you. And self-medications, it's not good. Don't start treating. What at all are you treating? Please go for, even if we've diagnosed that is prostate enlargement and you take drugs out, you have to make sure it's scientifically it is being approved and tested, and there are evidence that it's working. Thanks for your time. We brought this prostate enlargement to an end, and I hope you learned one or two things, and all your suggestions also count. So suggest any medical case you would like to know more about. Subscribe to my YouTube channel, Doris Opompoku. Like my Facebook page, Doris Opompoku, for more updates. Thank you.